Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 7 surprising causes and risk factors for carpal tunnel syndrome. It's very important to understand those causes because that will help us to get to the root cause of carpal tunnel and treat it effectively. So before I do that, I'm going to show you where is the carpal tunnel syndrome and why this occur as an issue. So first you can see the yellow color here. That's the median nerve that's going through the carpal tunnel. And when you start to have inflammation or swelling or fibrotic tissue, that area will be compressing on the median nerve, and you start to have carpal tunnel symptoms with numbness, tingling, or hand pain when you grip, or with severe condition actually throughout the day. So the first cause and risk factors is repetitive activity, and that's including a lot of typing, a lot of movement like this, like with construction work on that, using a hammer, or any motion that require a lot of this movement and a lot of typing or moving the wrist. That is a very common risk factor and cause for carpal tunnel. The other cause or risk factors is pregnancy and menopause, and that's usually happen when you have hormonal imbalance and swelling in the body, especially with pregnancy. When the body swells, it actually swells in the joint and it actually causes numbness and tingling pain, because in this area, as you see it here, there's not enough room for swelling, and that swelling will compress on the median nerve and cause the numbness and tingling in the hand. The third risk factor is diabetic. So patient that's diabetic, when they have a strain and their body is slow to heal, or inflammation as in relation to the high blood sugar, that could cause that carpal tunnel syndrome. The fourth cause is rheumatoid arthritis. Usually with the rheumatoid arthritis patient, they have inflammation in the joint, and that too much inflammation will actually could trigger the carpal tunnel syndrome. As I mentioned to you, hormonal imbalance related to pregnancy, but also actually, and the fifth cause is thyroid hormonal imbalance. I saw that with a lot of patients in my practice, that when they have thyroid hormonal imbalance, that is actually cause internal inflammation, the body slow to heal, so they might experience carpal tunnel syndrome. The other cause and risk factor is obesity, overweight, and that's swelling everywhere. And usually with obesity, you have internal inflammation throughout the joints, and that internal inflammation could lead to carpal tunnel syndrome. Very rare with the hereditary or genetic, that it's run in the family, but that's not a very common cause or risk factors. I will leave a link below for the 3 most effective approaches treatment to fix or get rid of carpal tunnel syndrome. If you have any question or comment, leave it in the comment section and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.